So maybe just a little bit about how this session came about. So Kim attended an EDI Wave 7 session in Richmond earlier in the year. We had a number of subsequent discussions, and through the course of those discussions felt it would be really valuable to host a similar session for our downtown West End planning table. So as many of us do, we reached out to Kate and the team at the Human Early Learning Partnership, or as we know it, HELP, for support. And in the course of those conversations, we felt it would be a terrific opportunity to extend the session to other planning tables and partners in Vancouver who, of course, are all involved in our sector. So despite a year, which we all know has brought endless challenges, we really wanted to create an opportunity for colleagues to come together, a sense of community. We wanted to create the space to reflect on the findings and consider how the results might guide our understanding and our respective priorities going forward. So that's how we're here today. I want to thank you again for making the time to join us, and thank you to Kate and the team at HELP for their invaluable support, and looking forward to the session today. Kate, I'll turn it over to you.
Great, thank you, Bernice. I'm just going to get our slides going. Okay, hopefully everyone can see those. We got that up on the screen? Great, okay. So thank you, Bernice, and good morning, everybody. My name is Kate Bume, and I work with the Human Early Learning Partnership as the Knowledge to Action Early Years Lead. My background is in social work, and I actually used to work at VSOP with Bernice and was a member of a couple of the Vancouver Early Years tables not so long ago, so I'm particularly excited about this session today. And excited that we actually get to do it. We started planning the session back when we actually thought this could be done in person, which feels somehow like a lifetime ago. So you can see from the first slide here that this presentation is a real collaborative effort. The folks that are listed on this slide are the presenters, but we have even a few more HELP faculty and staff with us today, and they may chime in as we go. And we were super encouraged to see so much enthusiasm for this session. We had a lot of registrants and lots of folks, I think, still filtering in. We had folks representing 10 different early years coalitions across the city, and also from many different organizations. But we really are curious to know who all is actually able to attend today. So if you could, as we go here, type your name and the organization that you represent into the chat room. I'll just say that again in case, so name and organization in the chat room if you could for our records. We'd love to just get a sense of who all is in the room, and if you're in a room with other folks, that if you could just add your names, that would be great, so we can see who all was able to join today. So as HELP is hosting this session, we wanted to acknowledge that our work at HELP and UBC is located on the traditional, ancestral, and unceded territories of the Musqueam people. And when we actually get to be on campus, we are very grateful to be able to work and play on such beautiful land. We have 2 hours together, which is quite a bit, so please take time to stand up and stretch every now and then. This is an outline of what we intend to cover. So we're going to start with a very brief overview of HELP. Then we're going to dig right into the Early Development Instrument, or EDI, looking at Wave 7 data trends briefly at the provincial level, and then more fulsomely for Vancouver, including some never before seen Wave 7 subscale data that Dr. Barry Forer will be reviewing with us today, which is great. Following that, we'll also look at a few neighborhoods data as well. And then following that, we'll explain and look at the gradient effect as seen across HELP's early years data sets, and Dr. Martin Kuhn will take us through that. We're going to have about a 10-minute breakout discussion time so we can just debrief, actually meet other folks that are attending this large session, and talk a little bit about what we've heard so far. And then following that, we'll hear from Zara Ismail, who is the Executive Director of both South Vancouver and Marple Neighborhood Houses. And she's going to share a little bit of an example of putting EDI data into action in community. And then Professor Brenda Poon, who's a professor with HELP as well, she'll talk about her research connections with Zara and what they're working on together at this time. Then, should we have time, We will do a brief review of some COVID-19 research on the impact of the pandemic on children and family that we are paying attention to at HELP. And finally, Kim Adamson, who is the General Manager of Childcare Development for the YMCA, will wrap things up and talk about some next steps around carrying this conversation forward. So very fulsome presentation today. I'm sure we're all well Zoom versed at this point, but we are going to ask that you keep yourselves on mute for the presentations. There will be obviously the chance to discuss, and you can unmute then. Because we have such a large group, we are going to ask that if you have questions and as they come to you, that you type those into the chat. We have Sally McBride, who is the manager of the Knowledge to Action team, with us today. She'll be monitoring the chat and being able to bring questions to those presenters as they come, and answering some as we go. If there are questions that are left at the end, we will follow up with an email. So if you have questions, it would be great to see them in the chat there. So, beginning, the Human Early Partnership is an interdisciplinary research institute at UBC, which means that we approach our vision of all children thriving in healthy societies from multiple perspectives, including child development, biological and public health, from an economic and policy level, among many others. And what I'm going to do now is turn over the screen to Dr. Martin Goon, who is the new interim director of HELP, but a longtime HELP faculty. So over to you, Martin.
Thanks a lot, Kate. Good morning, everyone. Great to see you all. I'll just highlight a few things that have happened with HELP in the last little while. We went through an external review, which is done with every unit at UBC every few years, and got really fabulous feedback from 3 researchers internationally who said our knowledge to action work is really outstanding, and how it's linked to the interdisciplinary research on child development that Kate just mentioned. Another thing that was highlighted is our close work with the original steering committee, which you see here on the picture, which has been working with us for over 15 years. And there's currently lots of exciting activity with some community-based research around early child development and, figuring out how to support services that are provided to families with young children. So I'd like to acknowledge that by, showing here a picture with all the members of our original steering committee. Thinking about our big vision of all children thriving, we have a framework, a theoretical framework that guides our work. Many of you may have seen this before, but and it sometimes may sound trite, that if we try to understand child development, we have to consider context, but it really creates quite a few pragmatic complexities when it comes to data collection, doing research, because of course children grow up over time with their epigenetic, with its genetic and biological makeup, but this happens within the context of interactions with family members. There are residential factors, neighborhood factors, community factors, access to resources, barriers to resources within, within those proximal environments. Then there are things that happen regionally, whether they are cultural or social, political, economic. There are certain policies that happen at the regional or provincial, national level that create economic money flows, and there's a global environment with regard to economic crisis. Currently, we of course are faced by one of the starkest public health crisis of our lifetime with COVID, and there's global warming and climate change. So all to say, there's lots of ecological layers that affect how children develop over time. And for us, the question is, which one do we need to attend to see how we can make a difference for children growing up into healthy and human beings. So one of our strategies to do this is to think about the data that we have at a systematic level for our population here in BC. And this is based on the adage that if we don't have any data, then there's no problem. We can't really identify the things apart maybe from anecdotal stories. And of course, if there's no problem that we can identify and describe, then it's hard to turn that into action. So a lot of our work is based on this idea of having a population-based monitoring system. And on the next slide, we see the whole suite of survey tools that we have been implementing or currently piloting and developing across the early life course trajectory here in BC. You'll hear from Barry Foro, of course, in detail around the EDI data that we have been collecting with 3 ministries across the province and the school system for 20 years. And then we have been collecting children's voices through the MDI, the Middle Years Development Instrument, which you see here in this orange color for grade 4, grade 7, so at age 9 and 12. So we have the children's voices, EDI is the teacher's voice, and then through the TDI and check, which I'll give you a few big picture highlights from our data collection, is parents' voices on early experiences of child development. The early years, as we know from research, are absolutely fundamental for life course trajectories. We'll say a little bit more about how that happens later. But there has really been no data, no systematic data on early experiences, social context, the socioeconomic environment for children between birth and school entry for the entire population. And this is where the TDI and the check come in. So as you see here on this graph, we're trying to systematically collect data all the way from when children start their life course, transition into school, go through the school years, and eventually we'll try to follow them into the transition into adulthood to really understand which of the factors in our society are making a difference for the wellness of children, and which of those are amenable to change, and which can be changed through either action at the policy level, through changing funding flows, or through the services that we provide. So one thing, if we go to the next slide, so you'll hear from Barry the data on the most recent EDI data, which really looks at how children's skills and competencies play out during that important transition from the early years into school. And
I think we'll turn it over to Barry to Barry at this point, Martin, and we'll come back.
Oh, sorry. I thought there was one more. Thanks. Go ahead.
Okay. Thank you.
Yeah,
Barry.
Thanks so much, Martin and Kate, and everybody else, of course, for all of your time and your interest. We all care a lot about the future of our children and our society, and it's always such a pleasure to be able to tell you some of the stuff that we're up to. For those of you who know the EDI very well, my apologies. There'll be some new stuff, but maybe some old stuff as well. If you go to the next slide, that would be great. Kate? Just a real quick kind of EDI 101. EDI is a kindergarten teacher administered tool that kind of has about 103 core questions that look at 5 different areas of development to kind of cover all the main ones that people think about. It's a population level tool as opposed to an individual assessment tool. In fact, we're very careful never to use it for purposes of looking at individual children's remediation or anything about them. But we do cover 5 main areas: physical health and well-being, social competence, and emotional maturity, language and cognitive development, and communication skills and general knowledge. Altogether about 103 questions. So next slide, please. And so, so we have, those are the 5 scales still. We do have a way of looking at them overall, which is about, kind of an overall sense of how well children are doing. And we'll see in a second, we talk about that in terms of vulnerability. But within almost all, about 4 of the 5 scales, we also have subscales. And if you can just kind of get them all out there, that'd be great. 3 or 4 subscales out there. Altogether, there's 15 subscales looking at different aspects of these 5 different domains of development, and it's useful to try to kind of to drill down a little bit into some of the more specifics. It just gives more information. Sometimes I would say a lot of information about what's happening with children across all the neighborhoods and school districts in the province. Next, please. Thank you. And so, as I was saying, with the EDI we focus on vulnerability. So, in other words, the focus is mostly on the children who are not doing as well as other children. And so, how do we decide what vulnerable means? Essentially, we went back to the beginning of when we first looked at the whole province, and kind of just got a sense for all of the different scales about at what point are we kind of identifying the say around the 10% of children who are have the lowest scores, who are doing the worst. Those are the ones, as you would imagine, who not only are scoring low on the EDI relative to other children, but they're also more likely to have problems as they go through school and into their adulthood. It isn't set in stone by any means, but it gives us a bit of a measure of which children are vulnerable at the point when they are entering their school years. Thank you. Just again, to give you an idea of how much we've been doing over the years, and I go back like Martin does almost to the beginning. Well, actually, in my case, before the beginning on the pilot phase, before wave 1, but we actually up to wave 7 have almost 300,000 EDI scores from children in kindergarten, a little over 40,000 on average per year, and that basically is kind of the size of the kindergarten cohort in the province every year. It goes up and down a little bit. We don't capture absolutely everybody, but 85–90% for sure. Now, each wave is a multi-year. It's a big project to try to do the EDI, and so we kind of spread it out over 2 or 3 years. The last few have been a 3-year wave, and the most recent one that we've completed is wave 7, which ended in the 2018-2019 school year. So if you think about that, we're already into wave 8. We had our first year of wave 8 last year, and we're in our second year of 3 years this year, and it's a very different year, being a COVID year. So we're facing some challenges around that, like everybody else is, but also some opportunities to gather some information. Okay, so let's see what we got. First of all, the big picture, and what's happening with overall vulnerability. The percentage of children in the whole province who are vulnerable on any one of the 5 scales, could be 1, 2, 3, 4, or 5 of those scales, at least one. And you can see at the very bottom there that we started off at around just under 30% of children vulnerable back in wave 2, which ended in 2004, so more than 15 years ago. And it's been more or less kind of a bit of a steady rise over the years. So now we're up to, in wave 7, just over a third of children, a difference of about 3.5%, which, by any standard is a pretty big change. It's still going up. We were a little dismayed to see it go up again from wave 6 to wave 7, when we were hoping it was starting to level off. And so that's the overall picture. We still have lots of children vulnerable, about a third. About a third is actually, out of 40,000 children in kindergarten in any particular year, that's 13,000 or 14,000 children. So it's a lot of children. But you see, they're not distributed equally. This is a map of all of the different school districts in the province by their numbers, and the darker the color red, the higher the vulnerability rate. The darkest one is for rates for a whole school district of over 45%, whereas the lightest ones are the ones that are under 15%. You can see most people are in the middle, as you might expect, but the lowest vulnerability in the province in wave 7 has been yes, has been in the Kootenays, and Revelstoke is kind of our poster child of low vulnerability, not just in wave 7, but overall. The range by school district is pretty wide. Goes all the way up to 55%, all the way down to 13. I think that was Revelstoke. And if you look at the actual neighborhoods in the province, almost all districts have more than one neighborhood. We have exactly 298 neighborhoods in the province, and so neighborhoods are smaller, and that means that some neighborhoods can actually, extend even farther in either direction. But in this case, Revelstoke is the only neighborhood in its school district, so it's still 13%, but it goes all the way up to 68% in wave 7, and it has been higher in the past. 68, if you're wondering, is for Strathcona in Vancouver, actually. Okay, let's keep on going. Okay, let's just see what the 5 different scales look like. Yeah, so you can see that we have trends that, okay, let's just get them all up here. I think it's probably the easiest thing to do. Okay, so the main picture here is that, of course, the individual scales start off way back in the beginning at 10%. They're much lower than the overall vulnerability rate, but they have tended, most of them, to kind of go up over time. The ones that are the exceptions to that rule are communication skills and general knowledge for the province, which has stayed more or less the same. And the one that kind of sticks out at the bottom there, which is language and cognitive development, which for most of the time that help has been gathering this information has been getting better and better until around wave 5, and then it's kind of reached a bit of a low and has kind of been creeping up since then. Okay, so that's for the whole province. Those are the trends. We'll look at Vancouver trends specifically in a couple of minutes. Okay, so wave 7 collected over a 3-year period ending in 2019. I'm hoping all of you have already, and if you haven't yet, will visit our website and check out your wave 7 reports. We have them for every school district, and within each school district, all the neighborhoods within that district. So it's really chock full of information and an explanation about EDI and how it changed in wave 7. Okay, so let's look at what's happening in Vancouver. The big picture again for Vancouver. Then we'll try to do a little bit of focusing in on part of Vancouver. Hard to do. There's 21 neighborhoods in Vancouver. So the big picture highlight is in Vancouver, it's been relatively stable over the long term and short term overall, but we'll see how that doesn't always play out exactly the same way in each of the scales. So let's go to the next one. It's interesting here. The dotted line is always British Columbia, and the solid line is Vancouver School District. So a big school district, but and so numbers don't jump around too much. These are pretty solid trends. But you see a bit of a difference there in that it looks, as you know from our provincial one, you see that the provincial overall vulnerability has tended to be going up over time. But the Vancouver one, as we were saying, has been kind of much more stable. I will say that if you kind of look at the long-term trend, which is from the beginning to the end of each line, you do see a drop in Vancouver. And in fact, Vancouver is this close to having a significant trend of decreasing vulnerability over time. Okay, where it started off quite a bit higher than the province as a whole, it's actually getting better and now is very similar to the provinces as a whole. Okay, still 35%. Okay, and that's over 1,000 children in Vancouver. So it's nothing to be totally proud of, but it's going in the right direction. For each of the individual scales, again, the solid line is the Vancouver line, and the dotted line is the BC line. Excuse me. We see a much more stable trend in physical health and well-being in Vancouver. It stayed around 15% all the way through. Whereas, in the province, it's actually gotten a little bit worse overall on the scale. But if you look at the subscales, which is actually on the next slide, this could be interesting to look at because no one's seen this before, and it requires a little bit of explanation. Subscales are not measured on using vulnerability. It's actually measured on a way of kind of standardizing the actual scores. It's not just the vulnerable children we're counting here, but everybody, and then putting everybody on a common scale. But the thing to pay attention to is that as with vulnerability, as you go up the scale, up from lower to higher, it means getting worse, and going down lower means it's getting better. And Vancouver, being a very big school district, doesn't bounce around a lot, and we have a big space in there for the graphs because at some neighborhoods there actually are some places that actually move around quite a bit, bounce around quite a bit, or can be very high or low. But in Vancouver, you have to kind of pay more attention to the right-hand side here. We use physical health as an example. There's 3 subscales in physical health and well-being, 3 aspects, each with its own set of questions. One about motor skills, one about physical independence, and one about physical readiness for the school day. The symbols mean that if it's a circle, gray circle, it means it hasn't changed. Long term is wave 2 to wave 7, and short term is wave 6 to wave 7. If it's a gray circle, it means it hasn't had a meaningful change. If it has an orange upward triangle, it means it's getting worse. So what we see here is that gross and fine motor skills haven't really changed in Vancouver over time, but there have been some long-term worsening in physical independence and some short-term worsening in physical readiness. Physical readiness are the things around coming to school tired or hungry or not properly dressed or late. It's hard to see the trends as well because of the colors, but if you pay attention to the symbols, I think you can see what's happening there. Let's go to the next one, which is social competence. And social competence, again, for BC as a whole, we see it's getting worse over time, but kind of leveling off. But for Vancouver specifically, it's actually really the same. It's gotten a little bit worse over time, but lately in the short term, it's been more stable. And then go into the subscales, there's 4 subscales in social competence, and it's pretty easy to interpret, although the trend lines are a bit hard to kind of see. But they're again, because there's a big number of children in Vancouver, it doesn't take a big change for it to be meaningful. But in all 4 of the subscales of social competence, we see a worsening over time, but only in the long term, but not in the short term, which might be some indication that things are starting to turn around potentially. Let's go to the next one, which is emotional maturity. This is the one that for the whole province has been going essentially straight up in a straight line. Vancouver's line doesn't look quite so straight, but the trend is really the same, which is that both on the long term and the short term, we're getting a worsening in terms of the percentage of children who are vulnerable on emotional maturity. Now, is that true for all of the different aspects of emotional maturity? We have to look at the subscales, which is the next one. Again, I would pay more attention to the symbols on the right, but indeed on all 4 subscales of emotional maturity, aggressive behavior, anxious and fearful behavior, hyperactivity and inattention, and pro-social helping behavior, there's a trend, a meaningful trend worth talking about of getting worse over time. And even for 3 of them, the first 3 there, in the short term, they are still going up and getting worse. Okay, so we have to spend more time on this, but we have a lot of slides. Okay, let's go down to one more. Language and cognitive, the good news story where we started off at 10% and have been around 10% ever since. Language and cognitive has been stable pretty much all the way through, and lower than the other scales. If you wanted to look at the subscales for that, you would see that you don't see a lot of trends over time in Vancouver, but on the short term, that being the last two waves from wave 6 to wave 7. There actually are two subscales where that tendency to get worse that we saw for the overall is true. It's for advanced literacy and for basic numeracy. There is a bit of a concern that those are the two that are getting worse. Otherwise, it's a very stable and relatively low score. You know, one thing I should have maybe mentioned is that 0 on this graph is where the province started in wave 2. So Vancouver is doing quite well compared to the rest of the province. It's a little bit below the line, which is better. Okay, one more, which is communication skills and general knowledge. And here we see probably the biggest difference between Vancouver and the province as a whole. With a good news story at the end, there's a higher percentage of children who are vulnerable on communication skills and general knowledge than in the province, but it has been declining in Vancouver over time, where it's been staying steady in the whole province. Both in the long term and the short term, it's getting better, and now there's not much difference between Vancouver and the province once we've gotten to wave 7. The reason it's higher in Vancouver is because communication skills and general knowledge is a scale that asks some questions about the ability of the child to be able to communicate in English, whether it's using language effectively or listening or tell a story. And those are things that are more of a burden for ESL children. And we have more ESL children in Vancouver than we have in the average school district. So overall, here's where all the different scales are. You know, if you remember for the whole province, language and cognitive is still at the bottom, and it still is for Vancouver. And the other ones were quite tightly bunched and tend to go up. But here we see a bit of separation on the communication skills and general knowledge. And that's an indication of the fact that there's more people from more newcomers in Vancouver than there are in the average place in the province. Okay, we keep on going. I know I'm at 17 minutes, so I'm going here. So how does Vancouver look compared to all BC school districts, all 59 of them? It depends on which scale you're looking at. You can see at 35%, Vancouver is kind of middle of the pack on overall vulnerability. And then if you look at each of the 5 scales, it depends, you know, and I think we talked about this a little bit. You know, Vancouver on language and cognitive is actually closer to the better side of the distribution for the whole province, but on communication skills and general knowledge, it's higher. But you know, it is a mixed bag, and that's one nice thing of looking at each of the scales separately. Okay, let's keep on going. Highlight number 2.
Barry, sorry, just there's one, we had a question from Joan just before you move on.
Sure.
Just to clarify, just to clarify the questions, how does EDI evaluate literacy skills in those children who have English as an additional language, not a first language? Oh,
literacy skills? Yeah, well, the literacy skills are the same for everybody. So, you know, so for instance, we talked about advanced literacy. There's actually 6 questions on that, you know, ability to read simple words, complex words, simple sentences, interested in writing, can write simple sentences, or writes, reading and writing simple words and complex words and sentences. So kids, yeah, I guess if your question is how can they do well in that if they're English as an additional language? Well, they, that's
Gary, may I just a brief note? We did a fairly comprehensive analysis looking at the different language backgrounds for children who are bilingual and those who have an ESL designation. And interestingly, a lot of the bilingual children are really excelling in several of the domains. It's not, you know, similar patterns across the board, but we do see that the bilingual children are on average doing really, really well.
Okay, thanks, Martin. Yeah.
Thanks.
Yeah, thank you very much. I know that's a short answer to a longer question, but okay, thanks, Sally. Onward and upward. Second highlight has to do with what we call multiple vulnerabilities, the percentage of children who have more than one scale that they're vulnerable on. And if you look at the next slide, it compares BC with Vancouver. The take-home message is that for BC as a whole, and it takes a little while to kind of look through this, but each of the colors talks about having more and more scales that you're vulnerable on. For BC, you can see that the bottom lightest color stays about stable over time, but those darker colors actually grow from 16% vulnerability to 20%. But in Vancouver, the change over the waves has been much more modest and actually has bounced around a bit more. So we are concerned because the more EDI scales that a child is vulnerable on, the more likely it is they're going to have problems going forward. But in Vancouver, at least, we don't see as much of a trend as we see in the whole province towards things getting worse in that way. Last highlight is about just the fact that the real story is about variability. And if you look across all the Vancouver neighborhoods, you get a sense of how variable this is. This is Wave 7, a Wave 7 map showing vulnerability on one or more scales and showing all 21 neighborhoods. I'm not sure how, hopefully you have a big enough monitor to be able to kind of see which place is which. But again, the lighter colors are lower vulnerability rates. The lowest one for Vancouver neighborhood is right in the middle there, Canby Riley Park, 20%. It's not always that low. And the highest ones are the darkest red ones. And there you see that Strathcona is dark red, being more than 45%, and also Marpole, although Marpole is not quite as high as Strathcona. A lot of variability. And it's the variability that we're really interested in, because we want to understand what causes that variability. How can we kind of create more equity in terms of the vulnerability of children across the province, and how can we bring it down as low as possible? So just to give a couple of quick slides on how things have changed across the different neighborhoods. If you look at the Wave 2 to Wave 7 change, which is our long-term change, you see that it's interesting that a lot of the more westerly neighborhoods have actually been the ones that have gotten worse, and the ones on the east side of Vancouver have tend to be the ones that have gotten better. It's interesting. But what about lately? Lately being the short-term trend. The next slide, you'll see there that it's a different pattern. You don't necessarily always stay the same, short-term to long-term, but there are more stable neighborhoods, because it's only from one 3-year period to the next. The longer you look, the more likely it is that you'll see a change that's significant. Okay, keep going, please. Okay, this is a bit high in information, but this is we're going to make a point here about numbers. This is a listing of all the 21 neighborhoods in Vancouver, from the highest to the lowest vulnerability rate on vulnerability overall on one or more scales in Wave 7. And you can see it goes from a high of 68 in Strathcona all the way down to a low of 20 in Canby Riley Park. You can kind of see where everybody is. But just to kind of put another kind of factor into play here, it isn't just about the vulnerability rate. It's also about how many children are vulnerable. So if you actually took this list and then calculated from the vulnerability rate how many children were actually vulnerable in each of these neighborhoods in Wave 7, which is the next slide, and ranked them that way, you would see it's actually Renfrew Collingwood that has the most vulnerable children. Their vulnerability rate's 41, but they have 120. It's a bigger place in terms of how many children there are. Kensington Cedar Cottage is a very large neighborhood, has lots and lots of children, only a 34% vulnerability rate, but again, the second highest number of vulnerable children. And so you have to, if you're trying to think big picture, particularly if you're not just thinking about these neighborhoods, but even as Zara is going to talk about South Vancouver, for instance, you have to kind of think a bit about numbers and not just about percentages. And I'll give you just one more kind of sense of that, which we often talk about, something at HELP called proportional universality. If we're trying to do the most help for society, sometimes it's nice to think about who who's the most vulnerable, or and certainly, as we'll see in a second, places that have socioeconomic disadvantage tend to have the most vulnerable children. But they also tend to be smaller numbers of children in the most disadvantaged neighborhoods than in the kind of typical middle class neighborhoods. It actually turns out that the number of vulnerable children is much higher in middle class neighborhoods, than in low SES neighborhoods. So you should think about that. We should need to think about not targeting so much, but doing what's proportionate universality, which is look at universal programs. There's vulnerability everywhere, but giving special attention to where you can some populations that are the most disadvantaged. Okay, if we go to the next one, I'm almost on time. Actually not. But it's a bit of an introduction to, Zara is going to be talking about South Vancouver, and there are 3 neighborhoods in that kind of like southeast side of Vancouver, and these are the 3: Victoria, Fraserview, Sunset, and Killarney. And but they have different patterns of vulnerability. This is vulnerability on one or more scales. It's really interesting to see that a place like Victoria, Fraserview has stayed pretty stable over time, whereas Sunset has been going down, and Killarney, who knows what's going on there. It kind of ballooned up for like 10 years and then came way down again. So you have to kind of pay attention to what's going on in those individual neighborhoods, because they can look quite different. Okay, let's go down, please. I think I'm going to skip this for time, but okay. But thinking of numbers, again, we have to think into the future as well. And one thing that we can get from places like BC Stats are some estimates about numbers. If you look at again, for South Vancouver, and just for 5-year-olds, and look at what the numbers of 5-year-olds are for all of South Vancouver, and then broken down by the 3 neighborhoods, you actually see that over the last 10 years has been a slight decline in the number of 5-year-olds. But starting in 2020 and going forward for the next 10 years, we're going to see quite a jump in the number of children. And of course, if vulnerability rates stay the same, that's going to be more vulnerable children. And where's the difference the greatest? It's I believe, in Sunset. So you can kind of do some projections that way. I think my last slide is just to keep in mind that socioeconomic factors, I think Zara is going to talk about this, have a very important role to play in terms of what you kind of are working with in neighborhoods, and what you might expect to see. In terms of our SES index at HELP, which uses 7 variables that we keep using over and over again to see how neighborhoods are changing over time. All 3 of the South Vancouver neighborhoods are lower SES than Vancouver as a whole, but Killarney is the one of the 3 that's doing the best, and the one you would expect to be doing the best. And it was also the one you may not remember, but had that interesting kind of balloon shape. So something's interesting going on there. Okay, I think that's it for that, and I'm happy to answer any questions if there's time. And that's it for me.
Thank you, Barry. And I'm just going to move us quickly to, here we go. I think we're going to turn it over. Maybe we'll pause for a minute. We'll let Dr. Goon go through his section, and then we'll have some time for a more solid question and answer period.
Great. Thanks, Barry, and thanks, Kate. Yeah, now I'll talk for a few minutes about this question. Why are we seeing these vulnerability trends? One key thing to implementing action and policies, of course, to understand the mechanisms through which poverty is related to child outcomes. On the map that we have brought here for Vancouver, we see the EDI vulnerability rates. This is wave 7, you just heard from Barry. And that some neighborhoods have higher vulnerability rates than others, and that is correlated with poverty. So on the left side, EDI score, vulnerability rates. On the right side, in different shades of black and gray, the percent of children living in low income family context. And this correlation is widely known and shows up basically everywhere in the health literature, and therefore is called the social gradient in health. So if you, on the next graph, we see EDI vulnerability rates plotted by income quintile. So as you go from left to right, you see the lowest income quintile. On the right, you see the highest income quintile. And for two of the waves, we plotted the average vulnerability rates, and you see they go from over 40% for wave 7 for the lowest income children, all the way down to around 27% for the highest income quintile. We saw the same gradient in wave 2, just overall vulnerability increased, of course, in the last 5 waves of EDI data collection. We see this type of association not just for the EDI scores, we see it for high school graduation, we see it for cancers, cardiovascular disease, and so forth. The question is, what is the mechanism, especially during the early years, that connects poverty through access barriers to child development outcomes? And this is where the TDI and the CHECK come in, the Toddler Development Instrument, the CHECK Childhood Experiences Questionnaire. Both are parent-completed surveys, so they add the parent's voice, and we ask questions in both during toddler age and kindergarten age about early experiences, but also the social context of the family, the community context to understand what the access barriers to resources are, and so forth. And here are some findings from our initial pilot data collections from communities across BC that link income to some of the questions we're asking. Some are maybe expected, you know, that we see the pattern, but there will probably also be some surprises. Here's the first question. Hunger. So we asked, during the past months, someone in the child's home went hungry at least one day. And you see that the percentage in relation to income is highest for families who have a annual family income of under 20,000. Around 12% reported that a child went hungry in their home. So that's pretty severe circumstances in terms of food security. And once you reach the 100,000 or more income range, nobody reports this. So very, very clear gradient, and maybe not too surprising, because of course you need money to put food on the table. If we go to some other questions, does not have a regular healthcare provider. Of course, we have a universal healthcare system, which is one of the, you know, the great policy context for Canada compared to some other nations. But we also see a gradient. The families who are in the lower income brackets more frequently report that they not have regular access to a healthcare provider, and that's fairly very, very infrequent for families who are in the 100,000 or more income category. If we go to the next question, this is about immunizations. Again, it's universally provided. In principle, it's free. But what we do see is, again, an income gradient. We see that we don't reach the 90+% coverage rate for the low income groups, which is required for herd immunity, whereas we reach this for the income brackets that are 100,000 and plus. I'll go through this fairly quickly. You know, for the next one is dental care. The question on the TDI is the child has had their teeth checked by a professional, and same thing. We see a very strong gradient. Of course, dental cavities are one of the most preventable early diseases. They often have fairly severe consequences and sometimes even lead to total anesthesia for children if they have to be treated. So again, fairly strong economic gradient. And then if we go to the next example, sweet beverage consumption, of course, a big public health emphasis because it's related to obesity and other long-term health outcomes. We see that children in low family income contexts are more likely to consume sweet beverages more than once per day, and it's less frequently happening in the high income groups. And for water consumption, which of course is recommended by public health, we see that children in high income families are more likely to follow that recommendation and drink water, which, you know, has to do also with access to either clean or safe drinking water and maybe some other dynamics. And here's some of surprises, even for activities that, you know, a lot of people would say, consider they're free. We see an income gradient. So outdoor play, we see happens less, according to our TDI data, in low-income family contexts than in high family income contexts. We see similar patterns for the check. So this is now parents reporting on their kids' experiences during the transition into kindergarten. Organized physical activities. So this is programs such as soccer or swimming, and reflecting on the age leading up to kindergarten. So this is the time before children are in school. We see the same income gradient. Children in low-income family contexts are less likely to participate in these activities. Of course, they cost money, they require time and access. If we go to the next example, reading books or stories or telling stories to your children, you know, of course, it's just a crude proxy of interactions between caregivers or parents and their children. And in principle, all you need is a book and time. But we see a gradient, which has to do with a lack of time or other stressors that affect children or families in low-income contexts. So we see that children in low-income families or their parents are less likely to read to their children on a regular basis. On the next one, we see screen time. We see the inverse. Children in low-income families are more likely to spend 2 hours or more in front of the screen. It's probably the cheapest babysitting around. We know that long-term detrimental health outcomes and cognitive outcomes are connected to an overconsumption of screen time. And then for the next example, we have neighborhood perceptions around relying on neighbors to support you in case you need help for chores. We see the same gradient. Of course, poverty is not randomly distributed in our society, and we see that the poverty rates are hugely different if you go from if you break it up by different racial or immigrant or First Nation status groups. So on the left, you see, for example, that the poverty rate for status First Nation children living on reserve is over 50%. And just picking one other example, you know, if you look at the immigrant children in the turquoise kind of bluish, you know, the poverty rate is over 30%. But then for the groups that are not racialized, non-immigrant, non-indigenous groups, the poverty rate is 12%. So huge variability when it comes to social determinants of how economic resources are distributed and how poverty is distributed in our society. What can we do about this? And I think this is, in principle, a hopeful story, but a lot of work to be done. So if you think about poverty creating such a big influence in terms of child development outcomes, there's, we're pointing out here a resource that's really fascinating. It describes in detail how the brain development is connected to early childhood experiences, and that way affects lifelong health and well-being outcomes. With a focus on biological pathways and some of the stressors that we just mentioned, you know, that I listed by going through the TDI and check data, such as poor nutrition, stress associated with poverty, and other types of economic and social marginalization. And what the research evidence shows is that this is, we don't just see that on EDI outcomes, but we also can trace that in the long term with regard to immune responses, development on the metabolic system and the cardiovascular system. So all the way into old age, we see that chronic diseases can be traced back to poor childhood experiences, at least to some extent. And the question now is, how do we create equity in our society when we, knowing that poverty is such a great barrier to access and that early child development experiences are so fundamental for lifelong health and well-being? Just leave you with one thought towards the end of you know, my section here. If you look at childhood poverty rates in BC, they have been declining. They're still relatively high at around, you know, 18, 19, 20%. This is the average, of course. but they have been declining over time. And the question is, what has the federal or the provincial government or society done in order to reduce poverty? And there are very promising signs. If we on the next slide, just to give you a couple of brief examples, there is a national child benefit supplement, that happened in the early 2000s and then was increased in the mid 2000s. And of course, more recently, the government introduced the universal child care benefit. And then here in BC, we have the child care reduction fee initiative. So there are lots of mechanisms that can be used to redistributing, wealth through taxes by the government, and they have made a dent. I'm saying that because there are things that need to happen at the policy, at the government level, in order to facilitate some of the things that we're talking about with regard to creating good experiences for families with young children. So I'll leave it there and see, if we have some time for questions and answers on any of this. Of course, Barry's presentation on EDI or anything that has come up for you. Thanks.
Thank you, Martine. I don't think, Sally, are there questions in the chat box?
No,
Nope.
not yet. Nope, just that first one so far.
Folks can try and unmute themselves. We have a big crowd, I think, at this point. What are we up to? Over 90 people. But if there's a question that someone wants to ask. Or you can continue typing them into the chat box.
I think we overwhelm them with facts.
I wonder if maybe it would be helpful to go into our breakout sessions and actually be able to talk this over in a smaller group. It's a little intimidating in such a large group. So perhaps what we'll do is give you a chance. We're going to randomly break folks into breakout rooms. And just really, this is a chance for you to debrief, as Barry just said, all the data that you just heard. And figure out, just have a discussion about what makes sense to you or what was surprising to you from what you heard. And especially around the EDI data, considering the current pandemic, what areas of child development, if any, do you think may be impacted? So when we break you into your groups, what we'd love it if you could just introduce yourselves briefly. So name, organization, maybe if you're a part of an early years coalition or table, that would be great to know too. So just, I think we're going to have about 10 minutes in these groups. So, and maybe 5 people, Sally, in a group, just to get a chance to see who else is here and have a little debrief. And then perhaps when we come back from that, folks will have a question or two. If when we come back, we can dig into them for a moment. Great. Okay. So welcome, folks, back. What we did have a few minutes before for questions, and there weren't any. I'm wondering if maybe the discussions brought up some questions that people would like to either put in the chat box or attempt to unmute and ask at this point. We do. You need to unmute if you, yeah.
We were just going to touch base on the impact of COVID and how that would affect all the data that we're seeing today or amplify some of the curves.
Yes. Meaning you were hoping to continue that good conversation.
It was just something that was started at the end, and I thought we could bring it up here because that's.
Maybe just a quick reflection. The EDI trends, of course, you have seen very present. The system was designed initially with exactly that in mind, that whatever shifts happen in society, we'll be able to see how they impact our children over time. And obviously, we're in the midst of this terrible pandemic, so data needs to yet to come in. So Elisa Almas is here on the call as well. She has been collecting the Czech data, and so that's been collected this fall. Then we'll have another round of EDI data collection happening in the spring. So very soon we'll be able to see what impact COVID will have had on the different domains of experiences and developmental outcomes.
we probably all have our own thoughts and theories about which areas will be impacted, and are maybe already, those of you that are working with young children are probably already seeing some of the impacts, or working with extra stressed parents are already seeing the impact. But this is the benefit of having long-term data collection, is that we will actually be able to track it across time and feed that back to you. We are hoping to capture any other thoughts, like as you have them. You don't have to share it with the whole group. If you just want to, we'd love to, if you had a thought or a comment coming out of that that discussion, just to add it to the chat box for our records, that would be great. We'd love to just get a sense of what's really standing out for you. I imagine it's a bit of a charged conversation at this point. You just get into a conversation. It's really a hard time to be talking about this data. And then we're popping you out of the discussion groups, and we're not in person, and et cetera. So acknowledging that this is hard. I see a question in the chat there. Can anyone speak to the sample sizes of the various scales of population data and how it might put results in context?
Yeah, maybe just a quick answer. EDI, of course, is over 90% for the province, so we have data for every neighborhood. The TDI and check data that I summarized have been done in about a dozen communities from across BC, so not represented for the entire BC context, but sample sizes of several hundred. So, you know, the trends that we're seeing, they're pretty consistent. But we don't have neighborhood to neighborhood data for the entire province. But stay tuned for the check. You know, we have been collecting in several districts multiple times, and you know, the reports in terms of variability between communities are in preparation. Does that help a bit with that question, I hope?
Yeah, I was also going to say a sample size. I mean, you know, some places, Vancouver is an interesting one because we use essentially the planning areas that exist already in the city of Vancouver, which is really good for kind of linking our EDI data with or MDI data or any of our data with other data that the city collects. But with the EDI, you know, in order to really have good, reliable results, especially in other parts of the province that are less densely populated, you know, we might have to kind of get the numbers up by taking the 2 out of the 3 years of a wave and collecting information from that. So we try to get at least 100 per children per neighborhood as a minimum size, and we set our neighborhoods so that we have that, and we can give some good trends. You can't really look at EDI scores for a school, for instance, because the numbers are too low. They bounce around too much.
Kate, do we have time for just a couple quick questions? I'm just wondering if, is Elisa with us, or maybe Martin, just around supports for non-English speaking parents for completing the check and the TDI, as well as plans for expansion or where they're at. That would be helpful.
Yeah, we've started with the translation into simplified Chinese, and I've been using that for the TDI, and it will be implemented for the check. And then based on that example or experience, we'll add other languages as we go along. We know that, of course, in order to have representation for our parent population, we'll have to get all the translations in place. So that's what we started.
And hi, Sally, I am here. With respect to expansion of the check, we've been in conversation with folks in Vancouver, including Colleen, who's in our meeting with us today, about bringing the check to Vancouver, as well as some other folks that are part of the early years who'd like to see this data available for communities in Vancouver. And so we hope to do that sometime in the near future. And then in other districts, we continue to be contacted by those who'd like to use it in their districts, and we're hoping to get a confirmed set of districts for next September, soon into the new year. So stay tuned for that.
And just to add, if I can, Elisa, to the check, it's collected by school districts, and in a number of school districts, they had different strategies for supporting parents, where English they're English language learners, if I'm not mistaken, and sometimes a translator was brought in to help support that, where there are no translations for the actual survey.
That's right, yeah, because the check was part of the regular intake process at a lot of schools. Parents are typically meeting with their child's new teacher when school starts, and so schools are set up to support those interactions anyway, and then they would tag on the check to that regular process. So that's why we're so lucky to be able to partner with school districts to collect this data, because they have those structures in place to support families as well.
Yeah. Great. I think we might move ahead now, and if there are questions, please just keep typing them in, and if we can't get to them, we will respond to questions via an email out to those who participated today. So what we're going to do now, I'm going to turn it over to Zara to take it from here, but just to explain. I was reaching out to a few folks in the early years around this session, and was really had the opportunity to talk to Zara about her story around the value that she sees in EDI data and how she's used it alongside other complementary data sources to focus on the issue of equity in South Vancouver. And so Zara Esmail, who is the Executive Director of South Vancouver Neighborhood House and Marpool Neighborhood House, was willing, and we were very grateful for her to come and provide us with a little bit of insight, or inspiration and insight into how we can use data toward positive action at this time. So I'm going to pass it over to you, Zara, next.
Great, thank you, Kate. Are you able to hear me?
Yes.
Okay, great. So hi, everybody. It's nice to see you all. I'd like to thank Kate and the EDI team for including me in today's presentation. I would like to acknowledge that I'm joining you today from the Coast Salish Territory, the Musqueam, Squamish, and Tsleil-Waututh First Nations land, which is unceded and occupied. As the leader of a couple of neighborhood houses on unceded land, it's really important to root ourselves in this reality when we are talking about strengthening the neighborhoods in unceded land. I want to acknowledge that there's a number of members of the South Vancouver Early Years table on this call today, and I'm very grateful to be able to be the voice for the table at this presentation, but I would encourage any of the members, you know who you are, to please chime in at any time to add to what I'm saying and correct me if I make any errors. And on a personal note, before I jump in, I want to share that when I joined South Vancouver Neighborhood House, which I'll refer to as SVNH throughout the presentation, in 2016, my daughter was almost 2. So as I started to learn about early years in the neighborhood and reflect on EDI data, both in the South Vancouver area and where I was living at the time, it really brought a lot of things to light for me, and it felt very close to home. So this whole process has been very near and dear to my heart, and I wanted to share that before jumping in. Next slide, please. Thank you. So South Vancouver is a large section of the city of Vancouver, and it's been treated as a single neighborhood for many decades. This includes asset mapping that we've done and any community development initiatives that I'm aware of that took place in the South Vancouver area were largely done thinking about the entire area overall. And over the last few years, you know, it's a big geography. It goes from Main Street down to Boundary, 41st down to the Fraser River. The most recent population is about 102,000 people. So that makes up approximately 15%, or a sixth of the city's population. There's a high density of children living in South Vancouver. About 51% of households have children, which is the highest in Vancouver. And maybe I'll go to the next slide to jump a little bit further in. So in 2016, South Vancouver Neighborhood House and the South Vancouver Family Place reestablished the South Vancouver Early Years Table. The table is made up of early years service providers with a presence in South Vancouver area, such as VSB Strong Start, ourselves, West Coast Child Care Resource Center, Pacific Immigrant Resources Society, BC Centre for Ability, Vancouver Public Library, Vancouver Coastal Health, and others. Together, we worked on strategic planning, gap analyses, and program collaboration across all of South Vancouver. We learned what was going on in the neighborhood at a high level, but I would say that we struggled to understand community-based issues on a deep level. Most definitely, there was a feeling that we were stretching ourselves very far, and we had a desire to go deeper in our understanding of community needs and opportunities. Census data tells us that, like I mentioned, approximately 15% of Vancouver's population lives in South Vancouver. The most recent BC stat is 102,000 people. It's important to note that according to the 2016 census data, 80% of those who live in South Vancouver are racialized. 56% are newcomers to Canada. 1 in 10 people does not have knowledge of English. The 3 South Vancouver neighborhoods have the highest percentage of households with children, as I mentioned, at 51%. So the table sat back and we asked ourselves, where was the support for young people, our little ones and our children and families in the neighborhood? What was going on that was causing this large populated area of the city to receive comparatively less investment than other areas in the city that were smaller in size, but that were recognized and treated as unique neighborhoods? Next slide, please. So in 2016, the Vancouver Early Years Partnership Coordinator did a presentation at the table about Wave 6 EDI data. It showed major discrepancies across the city of Vancouver and also across South Vancouver. The table realized that there was a major gap in early years programs and supports in Sunset, Victoria Fraserview, and Killarney, but primarily in Sunset. The results there in Wave 6 was that 52% of children were vulnerable. Sunset and Strathcona were the most vulnerable based on 2016 data, with the number of unique children, as was mentioned earlier, in Strathcona was around 29 children, and in Sunset it was about 156. In all of South Vancouver, according to Wave 6, 316 children were reported to be vulnerable on 1 or more scales. This makes up 1/4 of all vulnerable children in the entire city, with the total number of children vulnerable as 1,247. So that's 25%. With limited early years support across the region, we wanted to understand how vulnerable children in our neighborhoods were being supported. With South Vancouver's physical location being in Victoria Fraserview and South Vancouver Family Place's physical location being in Killarney, we further then asked ourselves as a table, how were children in Sunset being supported? Where could they go to access early years programs? Where could they go to be seen and to be heard and to be visible and to form community connection? Were they being equally provided with opportunities for family programming, parenting workshops, and other important supports, such as children that are available for children and families in other neighborhoods, including the one that I lived in? If not, why? What was going on to cause this systemic inequity? And how is it impacting the families in our neighborhoods? We also explored whether this issue of vulnerability may have been one that course corrected as children got older, because there is MDI data available that we could look at. Knowing what we know about the households in South Vancouver and the diversity and the newness of a lot of people, and the fact that we have a lot of non-English speakers, one of the questions I asked myself is this an issue that children, are very vulnerable because maybe they don't speak English, and after a year of kindergarten and, a little bit of socialization, they're able to, the vulnerability tapers off. Is that possible? And so we did look at the grade 7 MDI data quite closely from 2017 to 18, and we saw that children in the areas of Sunset, Victoria, Fraserview, and Killarney were still not doing as well as children in Vancouver overall. It looked like the middle years experience was more significant, or the vulnerabilities were more significant now in Killarney than in Sunset. We don't necessarily understand this, but we want to dig into this more to figure out what might be happening in each community so that we can work alongside the community to better respond and set more children and preteens up for success. As an early years table, we started shifting our focus based on what we learned from the EDI data to neighborhood-based asset mapping and working to understand what early years services were available not across South Vancouver overall, but in each individual region. We started thinking more about how the neighborhoods are different, what makes them unique, and what opportunities there are for 0 to 6 programming in Sunset, Victoria, Fraserview, and Killarney. Within these discussions, we started talking about the sub-neighborhoods within the 3 larger areas, such as South Hill, River District, and Champlain Heights. We started talking more about how easy or difficult it was for people in one neighborhood to get to another, and how that impacted the way that we were designing our programs and supports. The EDI data, next slide please. The EDI data helped us to understand what we already knew from our work every day, that the South Vancouver neighborhood is large and dynamic. We realized that if we kept speaking about this large region as one neighborhood, that nothing will really change and the current inequities that exist will stay the same. I think it's fair to say that we weren't okay with status quo, and we're probably still not. We had to make a shift in the way we were approaching our own work and in our own neighborhoods. We had to disrupt the status quo. So most people in South Vancouver, we realize, have limited connection not only to South Vancouver services overall, but also to their neighborhood. There isn't a lot of visibility of the South Vancouver areas. There's not a lot of neighborhood pride or neighborhood identity, I'd say, as compared to some other areas. Most people don't really know where Sunset starts or ends. And without a strong sense of place, it is difficult to invest in or advocate for one's neighborhood. This is, again, something we want to change. The next slide, please. Coming back to the South Van earlier table's work that was sparked by the Wave 6 EDI data, we worked with Sandra Menzer to do a deep dive into the neighborhood, with the research completed by Sandra and Kim Adamson that is available on the EDI website. The table started to realize that there were all sorts of inequities that were impacting health and well-being of people living in the 3 neighborhoods, Sunset, Victoria, Fraserview, and Killarney. All of this data, we're all aware, it's all out there. It's readily available. But looking at the EDI data, the way that it was presented, prompted us to go and look for further information. It kind of raised this question about what was going on and potentially how we could shift our approach to our neighborhood. This inspired us to want to create significant change. We looked at My Health, My Data, My Community data. We dug deeper into census data. We looked into Vancouver coastal health statistics, and we also turned to the community to learn what was happening for them. We started to understand the challenges and opportunities across the 3 South Vancouver neighborhoods in a deeper way. Next slide, please. In parallel to all of the learning and research we were doing, the table started to pilot programs as well. We received some funding through Success by 6, I believe in 2016 or 17, to try out pop-ups in the park, a model that is very successful in some other areas of the city. I would like to acknowledge Frogs in the Park, the Frog Hollow Neighborhood House team, and the Kitsilano Neighborhood House teams for their support in designing our pilot. Strategically, we picked pop-ups in different parts of South Vancouver, both with major concerns around social connectedness. We selected Memorial Park in South Hill and Champlain Heights as the 2 areas that we started these pop-ups. Our experience operating the pop-ups simultaneously showed us how truly different the neighborhoods across South Vancouver were and are. The number of participants, the level of engagement, the types of outreach, accessibility by transit, everything about the neighborhoods was different, and we needed to respond accordingly. The second phase of the project was to connect with neighborhood leaders who we met through the pop-ups and work with them to spark community connectedness. The purpose behind this component of the program was to help people identify and build visibility of people who were excluding themselves from programs or who were excluded by design, perhaps because of language, culture, ability, or a variety of other reasons. Peer connectors who we worked with led the design of community engagement activities or family meet and greet events based on their understanding of early years access across the South Vancouver area and based on where space to hold community gatherings was available. They ended up holding workshops at Sunset Community Centre, South Van Neighborhood House, Champlain Heights Community Centre, and Killarney Community Centre. At each session, participants had breakout conversations with very narrow geographic boundaries that they actually set themselves. These exercises and the community dialogue around them taught us a lot about access, barriers, engagement, and voice across the region. Language, of course, was a major hurdle to participation as the languages spoken across South Vancouver are varied and different from neighborhood to neighborhood. Next slide, please. What the pop-ups and peer connector programs showed us is that there are children and families all across South Vancouver neighborhoods who would happily participate in programs if more programs were available. People are craving social interaction. Many of the families are isolated, disconnected, and unaware of activities that might exist in other neighborhoods. It is important that family programs are easy to access with a stroller, that they're free or affordable, and that they are culturally appropriate. The response from participants was overwhelmingly positive, and the table was thrilled to receive funding from Vancouver Early Years Partnership to keep the programs running for a second year. It is important to note that all of our programs that I've described up until now were undertaken by the South Van Early Years table collectively. SVNH was the grant holder for the funds we received, but accountability for the program and the deliverables was to the table. We all recognized that in a very, very large geography, it was very difficult for one or two organizations to stretch and be effective for all families. And so we committed to working closely together to support the families how it made the most sense to them. If that meant a referral to a library or to a community center or to another entity that was closer to a family, then that's what we all committed to doing. It was about building connection and earlier support across South Vancouver area for and with local families. Next slide, please. So we learned a lot with the table based on research and through piloting activities and connecting with local residents. We had some great successes, and the table still meets monthly throughout COVID to talk about strategic collaboration, remain connected, and plan how we'll support the families in the neighborhood together. Based on what we learned, you may be wondering what SCNH as an organization did to make changes at a higher level. We were embarking on a strategic planning process last year and engaged the community through surveys available in multiple languages, focus groups with various stakeholders, and interviews. We learned from our partners what they were noticing about the neighborhood and asked people how they connected to programs and to each other. We started to look deeply at Sunset in particular and what could have led to the low EDI scores for over 150 children in Wave 6. This included using systems change tools and working in partnership with academics from University of Calgary and Virginia Tech. We started with a causal loop diagram, initially focusing on early years and a lack of infrastructure in Sunset. That was sort of one of the things we thought might be a driver for the lack of social connection, leading to poor EDI results. But through the course of our exploration, we shifted our focus on social connectedness, as it was our belief that improved social connectedness would positively impact early years development. The causal loop diagram was followed by a social network analysis with various partners, stakeholders, and community members living in Sunset. We are now working with Dr. Brenda Poon and her team at UBC on a community-based participatory action research project, which she will speak to shortly. In addition, we have shifted the way we talk to our members of our community, all the residents in South Vancouver, as well as our donors and partners about the neighborhood itself. We had an open conversation with United Way of the Lower Mainland about the gaps in Sunset, and they selected Sunset as a location for their new Hi Neighbor program, which has helped to spark community engagement in the area. We have also greatly developed our partnership with Moberly Arts and Cultural Center and introduced a family meal and other early years programs at the space, obviously in non-COVID times. We have our Punjabi-speaking settlement worker working off-site at the Sunset Community Center and Ross Street Temple 2 half-days a week, also during non-COVID times. And we've shifted the way that we approach our work to try to better respond to the needs across all of South Vancouver. The next slide, please. All of this led to a deep period of reflection for our organization, learning, visioning, and ultimately the development of our new strategic plan for SVNH. We are now committed to reframing South Vancouver, as you can see is the first strategic priority there, by shifting our ways of approaching and speaking about this large area in a way that is more respectful and reflective of the uniqueness of various neighborhoods within it. One question that has circled around in my mind is, what is it that held South Vancouver together in the first place? Is it that it's a region that was once thought of as a suburb of Vancouver? Is it that it's the neighborhood with most immigrants, visible minorities, and a high percentage of non-English speakers who perhaps didn't engage as much in being maybe a squeaky wheel, for lack of a better phrase? Is it that these neighborhoods are so far from downtown, which is thought of as the heart of the city, that they're somewhat forgotten? Regardless, none of these or any other option that we could come up with seem to us to be good ways to define a sixth of the city. We will continue to work hard to shift long-held approaches to planning across South Vancouver for ourselves as well as our partners. Think about livability, access, and equity, and strive to create a region where neighbors feel connected to one another and to the neighbors within which they live. Neighborhoods, within which they live. When we engage with local residents, we now encourage them to think not of the drawn borders of the SVNH catchment area, but we ask them to think about where they actually connect in the neighborhood. What places, programs, and people are accessible to them? We engage in brainstorming, visioning, and planning around placemaking in ways that are realistic and more meaningful to community members who can strengthen South Vancouver by strengthening their own neighborhood, whether that be South Hill, Punjabi Market, Victoria Drive, Champlain Heights, the River District, West Fraserlands, Nanaimo Park, or one of the other many neighborhoods across South Vancouver. This level of reframing takes more time, more energy, and more mindfulness on the part of SVNH staff and volunteers, but this is how we hope to create greater connection, increased voice, agency, and equity for and for South Vancouverites, and lead to meaningful change. I am very pleased to share that the City of Vancouver has selected South Vancouver Neighbourhood House as the operator of the new Fraser Commons Childcare Centre, which will be opening in September 2021 at Fraser Street and Marine Drive in the Sunset area. Fraser Commons also has a 1,500 square foot social purpose space attached to it that will function as a neighborhood hub, which will certainly help build social connection and improve early years support for children in the Sunset neighborhood. Both aspects of Fraser Commons, we hope, will lead to improved early childhood development, and the new location will most certainly help us move towards our goal of reframing South Vancouver. It's important to note that while the EDI data for Sunset, Victoria, Fraserview, and Killarney and Wave 7 looks much better overall, particularly in Sunset, the situation is still quite a concern to us. It still is that 23.5% of all children who are vulnerable in Vancouver live in South Vancouver. In Sunset, though the percentage of children vulnerable is now reported at 38%, that is still 107 children, which is the third highest number of children vulnerable, just behind Cedar Cottage and Renfrew Collingwood. We want to understand what has caused the improvement in Sunset from 52% vulnerability in Wave 6 to 38% vulnerability in Wave 7. Could this be related to perhaps gentrification? Could it be related to our efforts to improve early years support as an early years table over the past 3 years? Is there some other fact that's led to this improvement? And what can we do to ensure that those 107 children that are still vulnerable in Sunset and the big percentage of children across South Vancouver who are still struggling are better supported? More learning and analysis is needed, but over time and with new investments, we hope to be able to contribute to EDI data improving in Sunset and other parts of South Vancouver. Thank you very much.
Thank you, Zara. Lots of great information. Really appreciate you taking the time with us today. I think what I will do is ask maybe Brenda to speak now, and then we'll come back for a little bit of questions for both of you, okay? Great. Brenda, can we turn it to you?
Yeah, sure. Thanks, Kate. Hi, everyone. It's so great to connect and meet you all. With members of my Community Research and Engagement Lab, are just really grateful for partnerships with Zara and with South Vancouver Neighbourhood House, being one of our newest partners. We're just grateful for the collaboration. And we wanted to tell you a little bit about the work that we're doing together with South Vancouver, as well as with other community partners in BC. It's just really has been so inspiring to hear Zara speak about their use of data to identify some of the inequities that are happening within their community, as well as develop some strategies that can really help to address those inequities. I think what brought us together, Zara and I share some common connections, and some of that was related to our common interests as well in connectedness that occurs within communities, as well as some of the systemic barriers that influence those health inequities that they're observing. So with the support of the Vancouver Foundation and other funders, we've been able to work together with Zara and other partners in other communities in BC to focus on really co-designing some research and identifying some action areas where we'll be able to draw from population level data. So drawing from the patterns and results that are identified through the EDI to really do some focused, in-depth, community-based research with partner communities. And what we're doing, our general focus area is one of them being to support the social, emotional, and mental health and well-being of children and youth. And drawing from what we learned earlier today around the patterns around social competence and emotional maturity, we see that this is an area of concern for a number of our partners. We see the pattern over time, the data showing us that this is an area of vulnerability where we are seeing trends of increasing vulnerability. So this is an area of attention that we are deciding to focus our next phase of research on. The second focus of our research is also to better understand the ways that communities come together to support systemic change, ways that different organizations, sectors, members of community work together to support initiatives in their community collectively. How do they support collective action? And we know that even pre-COVID, we knew that we were hearing from our community partners that it's become increasingly difficult to collaborate. We know that there's been some funding shifts, some shifting in priorities that's made collaboration much more difficult and limited in some way, and just exacerbated with COVID this last year. So at the same time, we know that our community partners remain so strongly committed to finding ways to work together to focus on those pressing needs that their communities are facing. So we find that these partnered approaches, these partner projects with communities have been one avenue to be able to support bringing these community networks together on a shared priority. And that's really what we're doing. We're working with partners like South Vancouver Neighborhood House, with our other community partners, and really using a community-based action research approach, as Zara mentioned. We want to work together with communities at each phase of the research process. So what we're doing with communities is we're working together on identifying some priorities for research, drawing from our population level data, but also collectively identifying what are some priorities for research. Can we co-design the research together? Can we co-plan and co-implement that research? And then support research and knowledge development that can address or identify a priority or need within each of our partner communities. So just to give you a range of examples, in our current stage of work, we're able to work with Zara and her network of partners to focus on a priority area for them, which one of them being sunset. And we've talked about opportunities to dig deeper into developing a project that focuses on social emotional well-being that can support sunset in moving forward. And one opportunity could be the new child care center, for example. But we're also working with other communities in the province. So we're working with City of Kamloops, for example, and their new early years council on some of the ways that we can work together on a research project that can fit and align with their strategic priorities. Working with the Comox Valley as well on ways that we can intersect with their current initiatives on building connections. So building connections to promote service accessibility for families, promoting connectedness between families and service providers, really working together with them on their social innovation initiatives and finding ways that we can complement and extend their work. We're also forming new partnerships with their provincial multi-community initiatives on youth mental health. So we're looking ahead to the next phase of ways that we can work together with partner communities. And we've had the last phase of work working with our 2 to 3 communities and now expanding our networks into the next phase of work. And that's really one of the reasons I hope to reach out to you today, is just to tell you a little bit about this research that we're embarking on in the next phase of our work, because we're inviting new partners for the next 1 to 3 to 5 years of work, where we can continue this focus in partnered research, co-designing research that focuses on social emotional well-being and child and youth mental health. What we hope to do is hopefully develop knowledge within the community that supports their existing initiatives and aligns well with their priorities. But eventually, we're also hoping that we can support a platform of knowledge sharing, information sharing across communities, where we can really have like inter-community sharing of the learning that's happening through this partnered research. So we are moving to the next stage, inviting partnerships with other community networks, and just invite you to, contact me if you, are interested in discussing partnership opportunities, or just if you want to learn more about what our Community Research and Engagement Lab, or Core Lab for short, is working on in the next few years. So I think with that, I will turn it back to you, Kate. Thanks for this brief moment to be able to talk to you just a bit about what we're doing.
Thank you, Brenda. I know it's a lot of information we're trying to cram into this time, but really just an opportunity to hear some inspiring stories about positive work. I think for many of us, it's a time of feeling like, I'm sure most of the folks on the call, you've been in moments of just constantly reimagining how you can do your work right now. And, 1 minute we can meet in person, the next minute it's all online, and it's exhausting. And I'm sure many of us on the call are those of you working with children and families. It's a very challenging time. And so I know, even sitting in research, that I appreciate hearing Zara and Brenda talk about moving forward in positive ways of thinking about what the next steps are, and certainly with a lens on equity, because we know with this pandemic, equity is a major issue. It's continuing to be highlighted in all kinds of ways. And while I was hoping to then dig into the research on COVID to just highlight that even more, we're not going to get there right now. But maybe we have about 10 minutes left, and I want to give Kim a chance to wrap up. But maybe if there are any quick questions for Zara or Brenda at this point, I'll open the floor. Let's stop sharing so we can see each other. And again, feel free to type your questions in if you don't want to ask them to the large group. We'll also share the PowerPoint in a PDF form and give you contacts of various folks that spoke today. So if you do want to follow up on a conversation, you can do it that way.
Yeah. That's incredible work.
If someone is, maybe Adriana, if you're trying to ask a question, we can't hear. Okay. Okay. Well, I'm sure there would be questions if it was, we were in person and we could chat, but at this point, what I think we'll do is pass it over to Kim to just bring some conclusion to this, but talk about ways that you can carry this story forward moving on.
Thanks, Kate. So it's been great to have everyone involved today, and lots of information, and I know it's hard to watch your screen for such a long period of time, so I'll try to be quick. So just on behalf of our planning team, I want to start by thanking our friends at HELP, our Maten, Barry, Brenda, Kate, Sally, Alicia. We couldn't have pulled this off without your coordination. And thanks for the informative and important presentations. For most of us, the research that HELP conducts and shares is truly a gift to all of us involved in the delivery of programs to young children and their families. And it helps us to better understand our neighborhoods and communities and guides us in what we need to pay attention to. I also want to thank Zara from South Vancouver and Markwell Neighborhood Houses for sharing all the practical examples of how your organization is using the HELP's research and how you're working with your local community neighborhood table, South Vancouver Early Years Table. Thanks also to Bernice Scholten from VSOC and Dave Phillips from MCFD, who helped in organizing today's event, along with Kate from HELP. As Bernice mentioned, Kate and Bernice and Dave and I started planning this event early in 2020, and it was going to be an in-person event. We had a space at the library booked, and Dave had agreed to cover lunch, and then COVID happened. And we had started planning it because we know how important it is for us to come together, to work together, to connect, to collaborate, and to network. And in these times, we've had to settle for a Zoom meeting, but hopefully in the future, we'll be back to the point where we can gather together. As many of you will remember, that until recently, events like these had been coordinated by the Vancouver Early Years Partnership and coordinated by Sandra Menzer. And under Sandra's guidance, the Early Years Partnership spearheaded several initiatives that supported the early years sector throughout Vancouver. Some of the things that you may remember that we worked on was the neighborhood demographic reports that Zara referenced that they used in their planning. Those were sponsored through the Vancouver Early Years Partnership and prepared by Barry and his team at HELP. We also developed the selmatters.ca website, and if you haven't seen that, that's new to you, it's selmatters.ca, and it provides user-friendly messaging about the importance of social emotional learning and printable resources for sharing with your families. The Early Years Partnership also developed the Early Years Training Collaborative, where we brought together organizations that deliver professional development opportunities to look at it from a more coordinated approach across the city. And also the partnership organized early years planning and learning sessions. Some of you may have been at the session with Kimberly Schoner-Reichel back at probably about in 2018, I believe it was, in the fall. Anyway, just those are some of the examples of what our Vancouver Early Years Partnership worked on. And so today what we're wondering is, because of funding cuts, the partnership stopped, it ceased. But in many communities around BC, despite there was no resources to carry on, they have continued with their community-based early years tables. And I know how critically important in Vancouver, with such distinct neighborhoods, the early years neighborhood tables are. But the question we wanted to pose today is there an interest to know if we should be thinking about reactivating a Vancouver-wide early years partnership or council or network? So would there be value in us bringing together key stakeholders and representatives from the various neighborhood tables and from various sectors so that we can look at the things that we can work on together rather than each neighborhood working on the same thing, such as, for example, using the social emotional learning website, instead of everybody working on messaging around the importance of social emotional learning, having a citywide lens to look at that. So anyway, both HELP and MCFD have acknowledged that they see the value in there being a citywide table. And so I've posted on the chat room a link, and it's a link just to a simple form that all you would be offering would be your name, your email, and your organization if you're interested in carrying on a conversation about this. There's no commitment whatsoever. There's no obligation. It's just to see if there is an interest in reinvigorating some sort of a citywide partnership. So that's all I have today to say. And so on that note, I would like to thank everyone again, thank our colleagues at HELP, and thank you for giving of your very important and busy day to join us. And I just hope everyone stays safe, and I'll pass it back to Kate.